Points of conversation for this presentation: laws in the state of Florida, learning from our past, preparations, and how we as individuals can help. State laws of Florida include the State Emergency Management Act. Under the State Emergency Management Act, Chapter 252, Section 252-356 in the state of Florida covers the emergency and disaster planning provisions to assist persons with disabilities or limitations. This section strictly enforces procedures and plannings for persons dependent on others for care from another individual. Section 252-357 is written to ensure the monitoring of nursing homes and assisted living facilities during disaster. This requires nursing homes to have annual evaluations of plans and procedures for both employees and clients at each nursing home. This is due to St. Rita's, which was a nursing home impacted during Hurricane Katrina in New Orleans, Louisiana. This image is an image of St. Rita's Nursing Home post-Katrina. St. Rita's Nursing Home was located just outside of New Orleans. However, on August 29th of 2005, 32 of the 60 patients living in this nursing home were killed. This was due to the lack of laws and preparation during emergencies. As a country, we try not to repeat history, and instead we choose to learn from our mistakes. This is when the government created the Post-Katrina Emergency Management Reform Act of 2006, which allows for FEMA to come in and help without the request from a state. What does being prepared look like? Older adults are at an increased risk of disease and death during emergencies because of factors such as the following. 1. A higher prevalence of chronic condition, physical disability, cognitive impairment, and other functional limitations. 2. Dependence on support systems for medical care, medication, food, and other essential needs. 3. Potential limitations in their mobility, their access to transportation, or other aspects of functional autonomy. Having a physical disability or any impairment, it makes it increasingly difficult when emergencies are to come. With this often comes medication. Making sure that medications are refilled before an emergency takes place is crucial to maintain a healthy body and situation for any elder going through this event, as well as the possible limitations in their mobility, finding resources that are suitable for transporting these individuals. Next is how can we help? Whether it be a relative, friend, or stranger, we all have the ability to make a difference. Assisting those who are in need will result in a safer and smoother transition through an emergency, and we are able to fight against the odds of disease and death for elderlies during emergent times. Here are the references for the information presented in this slide.